Hemorrhage and bleeding control. So for this demonstration, I'm using our pediatric patient. Really keep in mind we have a spectrum of the lifespan. So patients could be anywhere from an infant all the way up to our elderly or our advanced aged adult patients. However, as we're controlling the hemorrhage, there are certain things. There are smaller bandage dressings, and then there are large dressings. So we're going to have to find out which one is going to be appropriate for that size injury that we're trying to control. Other ones come already prepackaged where there's a dressing in here as well as a bandage. So we have different size bandage dressings here that absorb the blood, and then we have dressings bandages that we would wrap around and secure our dressings in place. Other ones come commercialized. They may be impregnated with some type of clotting mechanism or hemostatic agent. Keep in mind that if the bleeding is not controlled, just with direct pressure, that we may end up using a tourniquet. Now this is a commercialized tourniquet, and this one is made at orange. They come in different colors. You'll also need to know how to make an improvised tourniquet using some type of large wadded, at least 3-inch type webbing material. In this case, this is a triangular bandage, but we can use anything that maybe at least is wide enough and that we can secure tight enough to compress the blood vessel artery so that no blood flow is then going through that area. All right, so first of all, let's go ahead and identify potential injury somewhere on the leg. We'd go ahead and put the direct pressure and make sure that the bleeding does stop. If the bleeding doesn't stop, we'll continue to add more dressings to it. Now, if the bleeding does stop here, we can use some kind of buddy aid or self-aid where the patient will then hold this in place, or we go ahead and use a roller gauze. I'm going to just demonstrate as you put the roller gauze, you're going to place one tail out, you're going to roll this over, and we're going to flip the tail back over this end so that when the next time we wrap this around, it's going to secure that tail end, causing this to be stuck and fastened into place. Now basically we're now going to just wrap this so that we can cover each ends of the dressing, bandage, excuse me, and we're going to continue to roll and secure this dressing in place with our bandage up here. And when we're done, we can go ahead and tuck, tie, or tape this into place. Now, just show you how to flip the tail. So you're going to take this, put one finger here, you're going to take the tail, and this end will go back around the leg. Then we can secure this directly on top. So we tie the tails together, and we'll tie that knot in place. Now, if there's a bigger area, then we use a bigger roller bandage here. For example, if the bleeding did not stop, then we want to place a tourniquet over that area. Now, when we're placing the tourniquet, we want to place it as proximal to that injury and never over a joint. If we wanted to save portions of the extremity, we would get it as close to the area at least possible and never over the joint, but then we want to make sure that this compresses right in the area where that artery is. And as you see me, I'm just placing this on, I'm trying to draft this really tight here. Then I'm going to take this windlass and continue to wind this as tight as possible until all bleeding is stopped. It'll then get secured back in place, and here is where I'd place our time and the date, and I'd keep this open and never covered, so always exposed so that we know that there's a tourniquet in place. This should be tight enough to obstruct all blood flow, so the leg has no distal parameters, no pulse, and the capillary refill is decreased. Now, they still might be able to wiggle or move their toes, and they may still have sensation, but the longer that this is kept under, the less metabolism, less blood flow and circulation metabolism is decreased to the lower extremity, distal to our tourniquet. If we were to use an improvised, as I mentioned, improvised type of tourniquet, you can use a triangular bandage here. We're just going to take this down and create this. It's a nice, good size width, so that we can go and place this on. And let me go ahead and put this on the arm here. So we place this on the arm, and it's peculiar that you're going to have to come around one more time, so that what we're doing is creating this nice flat webbing material that will be created as a tourniquet. So we'll come around one time, then we'll tie this knot over the top. Now as we secure this knot up here on the top, we're going to place another windlass in between this portion right here and then tie this close together. Now we're going to continue to tighten this until all bleeding stops. Then you're going to wrap these tails around so that they keep that windlass from moving, and so it's going to be in opposite directions. And you basically tie this back off. Again, we're going to then label the time, and in some cases we would go ahead and place a T on the forehead, and here's where we would place the time, keeping this tourniquet exposed. Again, the pulse should be absent because we put this tourniquet on extremely tight. In other quick situations, we can also use a blood pressure cuff that's placed around that area, and we're going to have to maintain that bulb is pressurized and that cuff maintains that pressure to decrease all blood flow. So we're going to have to monitor the blood pressure cuff. But that works quickly as a tourniqueting device. So as far as hemorrhage control, if we just go back and review. So we have these type of gauze dressings. There's 4x4s, there's smaller ones, there's 6x6, then there's large ABD and chest bandages that are extremely huge that we can use to secure into place to control the hemorrhage. There are different type of roller bandages. There are some kits that come with your dressing and your bandage, and then some that are impregnated again. And they come with this type of roll that just comes together. Here's your dressing, here's the bandage that rolls right around, and then it's secured into place. If the bleeding does not stop, we want to try it, and it's arterial where it continues to spurt out with each contraction of the heart. We're looking to put the tourniquet on, and we want to put this as proximal to the site as possible. Some programs, they'll tell you just go ahead and place it all the way up. However, wherever we're placing this, as we put the tourniquet on, it has to put that compression over that artery. So up here in the arm, we're looking for the axillary artery. Down here, we want to compress somewhere on that midline of this thigh area or the lower extremity, because that's where our artery runs down, the femoral artery runs down as it branches off from the iliacs. In non-compressible sites, potentially like in the abdomen, around the neck, or in the groin, so these are areas that it's very hard to put a tourniquet. You're going to have to be holding direct pressure the whole time, especially around the neck. We won't be able to put any kind of circumferential or dressing that we continue to wrap right around the carotid arteries in the neck. So you're going to be holding that in place, or you're going to be holding some kind of pressure somewhere in these areas that we can't use the tourniquet. Now there are hemostatic agents. There's such commercialized things such as quick clot. We place that in there, and that's supposed to help us to cause coagulation. Again, we have these type of 4x4 bandages. We have cling, roller gauze, 4x4 and larger dressings. We have our bandaging material and your tourniquet, both commercialized and improvised.